1/3 of all strokes are caused by atrial fibrillation or AFib. Do you know the telltale signs of AFib or if you or someone you love could be at risk? Dr. Charles Athill, cardiac electrophysiologist with Sharp Memorial Hospital, is joining us to share what you should know about treating this potentially serious heart condition. Welcome, doctor.
Thank you for having me, Laura.
Now, Sharp Memorial Hospital is offering a free webinar on advanced treatments for individuals with AFib, but could you provide a little bit more background or insight into what AFib actually is?
AFib stands for atrial fibrillation, which is as a result of a chaotic, abnormal firing of signals in the top chamber of the heart,
And as a result, that could lead to some pretty serious consequences.
including stroke, congestive heart failure, and chronic fatigue syndrome.
Now, let's talk risk factors. Who's at the greatest risk for AFib?
The biggest risk factor for atrial fibrillation is age. We find this problem in patients between the ages of 60 and 80. However, we've been seeing this in younger patients, probably because of awareness and also excessive use of alcohol.
There are likely people listening right now saying, wait, my heart's racing. It feels like it's an irregular heartbeat. Do I have AFib? What symptoms should they be looking out for?
Well, most people experience palpitations. They can have shortness of breath, chest pain. Some people feel lightheaded and dizzy. Others just feel a sensation of anxiety or weakness, and it is particularly worse with exercise.
Doctor, it seems like AFib is one of the more common heart conditions that you treat at Sharp Memorial. Is that why you're dedicating a free webinar exclusively to AFib?
Atrial fibrillation is quite common. It affects over 5 million people in the United States. Here at Sharp, we offer the full range of therapy, ranging from drug therapy to catheter ablation and a minimally invasive surgical procedure called a MAZE procedure, which is only offered by a few hospitals here in California and throughout the country.
And the reason it's so critical to pay attention to the warning signs and treat AFib is because it can lead to some pretty serious complications.
Atrial fibrillation can lead to blood clot formation, which can result in a stroke. It is very important that patients do not ignore their symptoms and seek out medical therapy early.
To learn more about Sharp Memorial Hospital's free AFib webinar, call 1-800-82-SHARP or visit sharp.com/AFib.